Hi, this is for my patients who may have just been diagnosed with tardive dyskinesia. Tardive dyskinesia. Tardive means delayed, dyskinesia means movement, delayed movements. What is tardive dyskinesia? It is a movement disorder. It is a neurological condition. Common things that happen: lip smacking. There's something called rabbit syndrome. You move your nose like a rabbit. Pill rolling. You do this all the time. There could be jerking, thrusting. Like, I'll stand up because I want to demonstrate the movements. Like, these are the jerky, uncoordinated movements if it gets bad. And I was doing like the tardive dyskinesia dance. Not that I think it's funny, I don't. It stresses me out. Tardive dyskinesia is very serious, and it really stresses psychiatrists out because it's one of the biggest stressors of putting someone on antipsychotic medication. Who gets it? People who have been placed on antipsychotic medication. The older medicines, Haldol, prednisone, trilofan, thorazine, Mellaril, they had a 4% risk of a year of causing tardive dyskinesia. The newer medicines, Risperdal, Abilify, Geodon, Latuda, Viralar, Rexulti, the newer generation atypical antipsychotics had a 0.4% risk a year of causing tardive dyskinesia. Also remember that people with drug and alcohol use are more prone to get it. People who are genetically predisposed to get it are much more prone to get it. And African Americans and Asian Americans are more prone to get it. It cannot kill you, and it can be permanent. But it can really get in the way of walking, eating. But I would say the biggest drawback of tardive dyskinesia is it's cosmetically disfiguring and psychologically unnerves and socially isolates people because they don't want to go in public because they're so ashamed or embarrassed by these movements. It can really interfere with, I've seen people have trouble eating or exercising or doing complex movements with their hands. It can be a problem. I worked in the back wards of the VA in North Chicago, at the North Chicago VA, which is the largest psychiatric VA in the country. And people who are in these back wards who'd been there for 30, 40 years, who started out on thorazine and stayed on Haldol or stelazine, they were doing all these movements. They were completely disfigured. What causes it? I'll do with my hand diagrams now, or hand. The atypical antipsychotics and the regular antipsychotics used to treat psychosis of bipolar disorder, schizophreniform disorder, schizoaffective disorder, schizophrenia. Anything that makes you psychotic, these drugs are used. Now they're being more used for sleep, anxiety, and bipolar disorder. But these drugs are more commonly used now than ever. So what causes it? Well, they block dopamine. And when you block dopamine, dopamine is a neurotransmitter in the body that controls autonomic functions, heart rate, blood pressure, all that kind of stuff. But also it controls voluntary motor movements. Okay, so the body, let's say these are receptors and this is a neuron. The neuron gets stimulated and it releases neurotransmitters. So we go from electrical to chemical. We picture all these little molecules here of neurotransmitters, i.e. dopamine. There are other ones, norepinephrine, epinephrine, serotonin, acetylcholine, GABA. But anyway, let's just talk about dopamine now. So we get stimulation of the nervous system. This is for my patients out there. So the nervous system gets stimulated, an electrical message, the brain initiates it, and then it releases chemicals. And the chemicals touch these dopamine receptors, and it goes back to electrical and it sends a message down the neural pathway. When you block these, that's what antipsychotics do. They're dopamine blockers. They block it. So then when there's an electrical signal and all the neurotransmitters come here, they can't stimulate these receptors. Well, what does the body do? It says, well, I don't like that. And there's a law of the universe called homeostasis. Whatever you do to the body, it undoes it. And it goes back to where it wants to be, even if that's a disease state. Well, when you block these receptors here, and these are blocked by the antipsychotics, well, the body makes more of these receptors and it makes them more sensitive. And that's what causes this hypersensitivity and this increased number of receptors to dopamine. This is believed to be a causative factor in causing tardive dyskinesia. So now you have tardive dyskinesia, you're getting the movements. The most common thing I've seen is the pill rolling and this funny movements of your lip. So now you call the doctor up, moi, and you say, hey doctor, I'm getting these movements, you warned me about this, and I'm like, joy. So now I'm like, well, these are your options. We can stop the antipsychotic and not use them anymore, which is impossible because you have a psychotic illness and you can't stop the medicine, because if we stop it, you'll become psychotically disorganized, do inappropriate things, and your life will be ruined, and you'll destroy your home life, your work, job, and your family. So that's out. So I'm like, stopping it's not an option. We can switch to antipsychotics, which may actually treat the tardive dyskinesia. Treat is a big word. They don't make it as bad and possibly make it better. And that's a big question on that possible. Clozapine, olanzapine. Those two drugs have a much lower incidence or none at all of causing tardive dyskinesia because they're low potency. High potency blockers, that means they're very strong at blocking the dopamine 2 receptor, cause tardive dyskinesia. Well, clozapine, great drug. I've done a video saying it's my favorite drug because it is the best one. It has a lot of nasty side effects, seizures, weight gain, can destroy your bone marrow. You could die from that. And you have to do serial CBCs every week for, I think, 6 months and every other week for 6 months. So that's a problem. Or you can go to olanzapine. Well, that one works, controls mood and psychosis, but it puts on a lot of weight. It can make you diabetic and cause a metabolic syndrome, insulin resistance, high triglycerides, high cholesterol, and high blood sugar. Okay, so no solutions are great. So now, what I normally do is someone gets it from Risperdal or Abilify, because I only use the new generation antipsychotics, Vyrelar, Latuda. What other new ones are out there? Rexulti. So I would say, well, we'll stop those, and then we'll try using either clozapine or olanzapine. You got to be on something, right? Otherwise, you become totally psychotic. So let's try ones that don't make it worse and may actually treat it. Now, here's some other weird stuff about tardive dyskinesia. When you remove the offending agent, let's say you were taking Latuda or Risperdal, you stop the progression of the illness, but the symptoms may be made worse by pulling someone off the antipsychotic. Yeah, I know, it's strange. The illness doesn't get worse, but the antipsychotic that's causing the illness may actually mask the symptoms. I hope I'm not losing anyone, because this is really for my patients. So anyway, I'll pull you off the offending drug, and I'm going to start the other ones and make it work. Now, is this illness, if I stop it, could it go away? Yes. In about 1/3 to 50% of cases, the symptoms go away or minimize. Some, they just stay for life. Nightmare. There are treatments now. There weren't. I guess 3-4 years ago, deutrabenazine, 6 to 24 milligrams a day, Austedo, and Ingressa, valbenazine. There's another one called tetrabenazine. I think that works too. but these could actually stop the tardive dyskinesia movements. And if being on them for a period of time, I've seen nothing's clear cut here. I've seen the movements go away. But we can minimize them dramatically with these medicines. So it's not a great situation, but I always work with people and I always solve the problem. So for my patients who are watching this, I will fix it. I'll do whatever it takes, and I catch it. I'm hyper vigilant, and the key here is prevention. I catch it before it gets bad. The minute I see it, boom, I'm Johnny on the spot. We got to fix this, because you can't let this get carried away. Because I remember what I saw in the back wards of the VA. If you let this go on and just keep them on it, it can get really bad. So I usually get a little movement. I'm a hawk, and I see a little thing in their fingers like this. I stop it. I move to plan B. I initiate treatment with the new tardive dyskinesia drugs. We go to low-potency antipsychotics like clozaril, olanzapine. There's a lot you can do so it doesn't progress and you don't have the symptoms. And that's the current thinking on tardive dyskinesia. Thanks.